Okay, so now we're going to talk about the treatment that we have for the treatments available for CF. And as we talked before, early on, there was nothing really to correct the problem of CF, just treat the symptoms. So we started with being able to control the malabsorption that was occurring because of the destruction of the cells that were needed to make the enzymes to break down fats and proteins. So we were able to compensate by adding exogenous pancreatic enzymes to control the malabsorption. And then we need to control infection when it happens, control the airway inflammation that occurs due to the problems with the CFTR in the lungs. And then finally, we got to being able to treat the underlying problem, which is trying to correct or modulate the CFTR. So we're going to talk about each of these therapies. So we'll start out with, these are the new, by the way, these CFTR transport modulators are the new drugs that when I talk about new drugs, that's what we're talking about. Okay. So first, the control of malabsorption. We gave exogenous enzymes to be able to, so that the patients can actually absorb fats and proteins. Otherwise, they just go right through them because of the lack of these enzymes that are in normal people sent out from their pancreas into the gut in order to absorb these different foods, and these enzymes will break down the food so they can be absorbed. I don't expect you to memorize all of these numbers, but as you can see, here's where we start out. If they're a year old, they get 2,000 to 4,000 units per meal. And that's per like 120 ml formula, one bottle or one feeding. And you can see they change with the age. And I can tell you, it's not a science, it's an art. And so usually they will start with on the lower end of the enzymes. And what you do is you monitor the signs and symptoms. If the baby's crying a lot and has stools that look like the food's coming right through them, and fatty stools, smelly stools, that means that they're not absorbing the fats and proteins. So you need to increase their enzymes. Now, what you have to be careful of is increasing them too much to give them constipation and possibly blocking of the intestines, and that's a medical emergency. So you have to be careful about that. For adults is probably the thing you need to know. Anything above 2,500 units per kilogram per meal should be investigated. That doesn't mean that it's too much, but it's starting to get to be concerning. If it's more than 6,000 units per kilogram per meal, there's been you're at high risk for colonic strictures. So you don't want that to happen. So those are the things that I think pharmacists should know so that they check the dosage of the enzymes that are given to CF patients. So this is something that pharmacists should know. And I will ask you to memorize 6,000 units per kilogram per meal, because I don't think you should dispense that without talking to the doctor, having a relationship with the doctor, and making sure you understand that this has been carefully checked. The enzymes are given as microencapsulated spheres. So the nice thing about that is that you can open up the capsule and just administer the what we call them beads. They were like little beads that could go in some applesauce or even like on the nipple of a bottle or on the nipple of a mother, to be able, so the baby would get those spheres. They don't have to be in the capsule. So here's several of the different types of enzymes that are available, and what you want to stick with the brand that they are using. Don't mess around with that. Don't use VioCase. I don't think it's even available anymore. Do not substitute, as I said. And here's a link to the clinical guidelines about pancreatic enzymes in CF. So here's our available. So these are the ones you really don't want to use. This immediate release, I don't think there's any reason that you would use these. These are the ones that are available, and you can see they're all just a little bit different, which is annoying, which is why you can't switch between. But they are dosed based upon their lipase, the amount of lipase. I should have said that back here. So the lipase is what determines how many units they get, and it's usually 1 part lipase to about 4 of protease and 4 of amylase. So you can see what the different strengths that these come in, and they're all just a little bit different. So the pharmacist role. So in this case of my son, they started him on Creon 6,000 units. So that's 6,000 units of lipase. And he was to get a half a capsule with meals and a half of a capsule with snacks. So you have to eyeball that. So that's kind of tricky. Now, another thing that they need are the A, D, E, K. So you should recognize what is A, D, E, and K. Those are vitamins that are fat soluble, right? So since they can't absorb fat, they can't absorb these enzymes either. So we have to give these enzymes with the, give these vitamins with the enzymes. So we have to give ADEK, and this was drops because he was a baby at the time, 1 ml every day. So CF patients need enzymes replaced and the fat soluble vitamins, A, D, E, and K. They need both of these replaced. So this shows what the Creon had. So he was getting half of this. So he's getting 3,000 units of lipase. And what's half of 19? So that would be 950, 9,500 of protease and 15,000 of the amylase every time he got a dose. Oopsie. If you're in a situation where you're up against that limit of 6,000 units per kilogram per meal, and you need more, they still have fatty stools, and we call them sinkers or floaters. There's a lot of gross stuff in CF, and one of those is examining what your stools look like. You can add an H2 antagonist, which will increase the pH in the GI tract, which will allow for more of the enzyme to survive the GI tract. So an H2 antagonist being added might be able to help this patient get more benefit from the enzymes that they're taking. And also about 85% of CF patients also have GERD, so it sort of is a double duty. As we said, patients have to take A, D, E, and K because these are the fat soluble vitamins, and they won't absorb these naturally. So you have to administer this. And here's these are the suggested doses of each of these vitamins. And there are preparations available to buy to be prescribed for these patients. There's also a new formulation for CF specific vitamins. They're a little bit more expensive. My son, for example, I do believe he takes these now, but yeah, there's more antioxidants in there, and there's a little better absorption with the microsphere technology they've added. Caloric intake, you want to increase calories. That's one of the good things about having cystic fibrosis is my son, every morning we get a chocolate shake and bacon and as many calories as possible because they're constantly fighting inflammation and their body is kind of in a constant state of a hypermetabolic state. They need more calories. They're constantly fighting things. So you can eat as many calories as you want usually. Maybe not totally, but you have to make sure you take enough enzymes to be able to handle the fat and protein that you're taking. But they should be eating many meals. So 3 to 4 meals a day and 2 to 4 snacks. and they will have a dietitian on the team that helps these families and adults with CF to make sure that they're getting enough of this. And then you have to make sure they have enough enzymes. And this is an issue because I can tell you one of the times that I had to switch pharmacies, and the pharmacist rejected would not fill our enzyme prescription because they said, well, there's 3 meals a day. So 3 meals times whatever number of capsules times 30 was how much he was going to dispense. And he acted like I was trying to rip off insurance or something. And I said, no, the doctor wrote for the number of enzymes that he needs because he has to have 3 to 4 meals per day and 2 to 4 snacks per day. So you want to make sure that when you're calculating the number of enzymes that the patient needs, that you take into consideration the fact that they have to eat more meals and snacks than other people because you're trying to keep their calories up. All right, that's it. We'll talk about infection next.